Good afternoon, everyone. This is Dr. Amit Singh. First of all, I would like to introduce myself. I am a medical undergraduate, which I passed in nearly 25 years back. Then I did my post-graduation in medicine and then worked with multiple organizations, including WHO, government, and in the medical education for last around 25 years. So I'm in teaching, administration, as well as facilitating medical education. And I landed in Zambia. Right now I'm working as dean here. So it's privilege to me or privilege for me to be a part of this discussion. So I will share my experience as well as would like to hear from all of you. So the participants who are here, I would like to tell you that no other profession is noble like medicine. I think you all will agree with me. And when I started my career in school, the choice number one was to study medicine. And I would like to ask whoever the participant here is, can anyone summarize or tell why this is the number one profession or regarded as number one profession? Why just after schooling we are inclined to medical profession? Let's go to do some medical degree. Why it is regarded as the best? Okay, fine. So medicine is regarded as the noble profession, and when we start our career or anyone starts his or her career, they look after this profession with a respect and dignity. The reason behind is that this is the only profession which gives you the opportunity to save a human life. And when I say human life, then it carries a lot of weightage, because in none of the profession you are exposed to or you are in such a scenario or a situation that you are able to save a human life or even counsel a patient who is coming to you for a better health aspects or quality of life. So this is a profession which is most sought, and again the profession requires a lot of commitment. So we are here at Texila and we are trying to transform as well as trying to say facilitate this particular program. This is MBChB program, and which is of 5 years, which consists of initial 2 years as preclinicals and then next 3 years as clinical. So the question which can be asked, why in Texila? So why Texila? Because Texila is a university which has established here in last 3 or 4 years, and now we are having a position or a mark in the country. So we are blended with a fantastic infrastructure here, and that infrastructure gives us the opportunity to serve this particular area with blend of faculties from different countries, as well as students are also from very different countries. I think 18 countries are here, or there is a representation of around 18 countries here. So in preclinical, or say preclinical, we have multiple subjects. The curriculum has been designed as per the requirement. So preclinical is of 2 years, followed by 3 years of clinical courses. And as I told you that the preclinical will be blended by lectures as well as the labs, and the beautiful thing that is dissection. In the very first year, you will be interacting with these anatomy faculties, and we are having facility for dissection of human body. So in anatomy, basically we teach how human body is made or constructed or constituted, and inside the human body, the muscles, the bones, what is inside your head, that is also important. So that is taught here. We are having a dedicated dissection hall, and the faculties are expert here who take care of that, followed by the physiology, the biochemistry, for which again we are having dedicated faculties. And then in the second year, again you will be promoted after first session, or say first year, which will be having again blend of subjects. And for the growth of the personality, because I tell you very frankly, to become a doctor, it's not important the knowledge only, but you have to develop a very good communication skill, and you are supposed to interact with each and every one whoever is coming to you. So the patients can be a 6-month infant, a patient can be 85-year-old fellow. You have to prove yourself there also. So that is also taught under behavioral sciences as well as medical ethics. And then you will be having pathology, microbiology, and pharmacology. In pathology, the disease state or the organ, the changes in the organs, pathological change in the organs. Microbiology, how we are dealing with bacteria, the viruses. Designated labs are here for the practical sessions, and the faculties take a special interest in those practical sessions. For the pharmacology, again, we are having a very good blend of faculties plus lab, where we teach the drugs, the composition of the drugs, how drugs act in the body. And then we go for the clinical classes, which is of 3 years. And in these 3 years, we are having MOU with different hospitals. Right now, the biggest hospital which is here is UTH, which is having 2,500 clinical beds, followed by Levy Hospital, around 1,000 bed, and then Minasoko Hospital, and then Chainama Hospital. So multiple hospitals are taken in consideration for the exposure of the students as well as the learning. So there is an opportunity, or there will be opportunity. Anybody who is coming to Texila will be exposed to these clinical scenarios where we are getting patients not only from Lusaka, but from the periphery, as well as the nearby countries who are here. The patients are from there. So there is a ample scope of learning as well as exposure. So anybody who is coming to Texila will be having a exposure, learning, as well as the thing which we required to bring best in you and to become a very good doctor or say clinician. This is regarding undergraduate program, and we are planning, since we are in 3rd or 4th year here, we are planning to launch our postgraduate program also. So this is in brief about the MBChB program which we are running in Texila, with a fantastic infrastructure, blend of faculties, and hospital facilities.
Okay, so I just like to talk about my journey here at Texila. So
Great.
my journey with Texila has been exceptional, and honestly, it's been 6 months only, and we definitely had the disturbances because of COVID and all of that. But in all honesty, I have learned a lot, and it's not just about academics. I think as a person, I have grown as well. So earlier this year, with when I was
No,
starting
I would
out with
especially say,
uni.
Musangi, especially I would like to say that what was your experience during the COVID, the teaching learning session, and how it was carried out by Texila?
I think it was exceptional, honestly. We had classes from Monday to Friday every day, and our lecturers were always on time and they were always straight to the point with what they were teaching us. And honestly, I think it did help a lot, as the COVID time was a bit stressful when it comes to academics, because it's a little bit harder having to learn at home. But I think our lecturers, our faculty really stepped up their A game when they were carrying out lessons during the COVID time.
So basically, it was not affected. We carried out the online classes
Oh,
as per the schedule.
yes, we did carry out online classes, and because it was for 2 months, if I'm not mistaken, so we did carry out the online classes. And I mean, it was a little bit different from being at school, but I think we did a pretty good job.
Great, continue.
All right. So, yeah, I think Texila does provide a comfortable environment for its students, and I'm sure a lot of students would testify as that. Now, one would ask me what I mean by a comfortable environment. So I'll talk about the first interaction that I had with Texila, and this was with one of the student advisors, and it was honestly simply amazing because I remember speaking to her over the phone, and the conversation was very interactive, and she was very nice and understanding and quite helpful. And this gave me an insight on a little bit of the values that the university has. And that goes for the faculty as well, because I mean, the lectures are interactive and they do help you grow as a person as well. And they also help you with your communication and teamwork skills, which are qualities that are definitely that we should definitely have in order for us to become great medical doctors, as you earlier mentioned, Dr. Amit. I think another reason why I would advise people to choose to study medicine at Texila is the fact that we have state of the art infrastructure there. So I'm going to talk about a little experience that I had when I first visited one of the campuses. So I will be honest, I instantly fell in love with it. I mean, the labs are well equipped, they're air conditioned, the classrooms are all well equipped and air conditioned. And I honestly think that if you're going to do something as challenging as medicine, then you should do it in a place that is nice, that is clean, and has a very good environment, and a place that will push you to work harder and be a better version of yourself, which will make you an efficient doctor in the near future, of course. So yeah. One other beautiful thing about Texila, I think, is the fact that it provides a culturally diverse environment. So when we do become doctors, we're definitely, no matter where we will be working, we're definitely going to meet different types of people. So you can talk about differences in backgrounds and race, so whatever you can think of. So I think one great thing about Texila is that it has students from all parts of the world, which gives you kind of some exposure, like I'll talk about my friend group alone. We have like 6 different nationalities in my friend group. And if I'm being honest, this has taught me so much. So I'm learning and understanding as well as accepting so much about people from different walks of life. And I think this is going to help me when I do become a doctor and meet different types of people. So it's definitely going to be something that will help me in the near future. And yeah, so in conclusion, I think if someone is to pursue something as big as a career in the medical field, then I think they should definitely choose Texila to be part of their journey, because not only will they acquire so much knowledge, but they will also attain a lot of qualities that they will need in the near future or as a doctor. And I think they won't regret it, because it's only been 6 months. I've only been with Texila for 6 months, but my journey here so far has been exceptional. So I definitely recommend it to anyone who's thinking of attaining a career in the medical field.
Thank you, Musangi. It was fantastic hearing from
Thank
you.
you so much.
I usually interact with the students each and every year, and before this place also, and here also. Today I was also interacting with the students who were progressing from HPFP to MBChB. So the one question which I usually ask, what do you want to become? So the answer which comes usually is cardiothoracic surgeon, neurosurgeon, orthopedician, pediatrician, gynecologist, and there are multiple things which a student or at that particular age a person is supposed to know. But to become a cardiothoracic surgeon, what do we need? To become a neurosurgeon, what do you need? To become a pediatrician, what do you need? Fine. These are the branches or the specialty which is supposed to be specialized in future, but before reaching to that specialties or super specialty, you need a basic qualification. And that basic qualification is MBChB. This is the undergraduate qualification, which is you are supposed to have to become a qualified professional in a particular field. And when I'm talking about particular field or specialty, that is not supposed to be localized to a particular or a specified area. With my experience, I would like to say that people still who do MBChB and who are dedicated, they want to serve the people, can become general practitioners, what we call GP. And still, the 70% of the world population are deprived of basic health facilities. Either you go to the Asian region or the African region, and in the European as well as the American region, the disease or the sufferings are very different. What we are suffering here may not be there. So when you aim to become a doctor, a clinician, you should know what your target is or what you want to become. Because the problems what we are facing in a part of world cannot be in another part of the world. So the aim should not be to be a localized or summarized to a particular area. What you're supposed to be, you're supposed to be a global doctor. And to become a global doctor, you need a lot of dedication. And you have to master this particular program that is known as MBChB. And when you are going to start this particular journey, what I was discussing, it's very interesting and fantastic. The reason being, let's discuss forensic medicine. What is forensic medicine? Some people used to, what is this forensic medicine? I wanted to go to secret services. Why am I want to become a doctor? No, here also you can do these secret services. If you're posted in emergency as a medical officer, suddenly a dead body is coming to you, and people are claiming that this particular person committed suicide. But the another party is coming, no, that is not the problem with this particular fellow. He was murdered by few people. It's a homicide. How to differentiate between suicide and homicide? How to differentiate between a gunshot injury, which was inflicted by self or somebody else? A patient is coming with burn, was it was suicidal or some other inflicted people who came and did that particular thing? This is a branch of medicine which deals with forensic medicine, which we call forensic medicine, which deals to differentiate between these criminal aspects. So it is also taught under medicine. We teach law also under medicine. Public health. There is a possibility, you will be amazed to know that even if we want to predict a vector-borne disease in a particular area, we can do that. Suppose some quarter or some the area of the world who are having prevalence of malaria or dengue fever, Japanese encephalitis, yellow fever. We know that all these diseases are transmitted by vectors or mosquitoes. So we are having GPS technology by which we can detect if there is a increased activity of mosquitoes or vector in a particular area, then we can predict that this particular area can suffer in future or in next coming days with that particular disease as malaria or yellow fever or dengue. That you can also do as a part of this medicine. Not only becoming a doctor is treating patients only. You can go in research. You will be amazed. We are suffering with this COVID-19 for last 2 years. But just see the vaccines which are available globally on global platform. Multiple vaccines have come up in just 1 year. Who did this? The doctors who are carrying on this research. So you're not confined only to treating patients and going to hospital. You can have multiple aspects in your life as a doctor. You can become a very good CTVS surgeon. And I would like to share this story. When I was a medical graduate, when I was doing internship, so I was rotating in CTVS department, and my consultant told me that day that, Amit, tomorrow you are coming to assist open cardiac surgery. That was the first and fantastic day of my life. And next day, I was supposed to assist a open cardiac surgery as an intern. And that day, it was the experience of my life when I devoted my 8 hours assisting open cardiac surgery. I saw for the first time an open heart surgery where the heart was pulsating and there was a valvoplasty was done on that particular day. And my name was written on the case sheet as assistant who assisted in this open cardiac surgery. So that pleasure is a very different pleasure and which can only be achieved by this particular program, which is known as MBChB, which can make you a future clinician, a researcher, doctor, and not only doctor, a policy maker. You are a qualified. You can decide the policy of a state, of a country. We all know that people are suffering. People are dying because of cholera, because of tuberculosis, because of diarrhea, because these diseases are endemic in some part of the country where people are not having privilege of even safe drinking water. For that purpose also, you can be there. You can decide those policies. There are multiple organizations which are working on that. UNICEF, WHO, USAID, they are trying to uplift the quality of life. So this is not the only aspect of medicine that after studying medicine, you will become a doctor to treat patient, but there are so many aspects and so many sectors where you can do and you can apply your knowledge. So I would just say that this is just the beginning. This is just the beginning. MBChB is just the beginning. And this is the first step to climb that particular target or say hill that you want to. And as I am discussing again, so just imagine what will be the pleasure if you are doing a neurosurgery, surgery on brain. What will be the pleasure? And these are the very big things. If you go to a small thing, even if you are GP, general practitioner, a patient is coming to you, and you just counsel that you just take these drugs, you will be fantastic. The smile on his face, oh doctor, you are saying that I will be good, and the smile that will bring to his face that, oh, you told me that I will be okay, and that will give the confidence to that patient. And when you will see that patient coming back to you after 10 days, oh, thank you doctor, you cured me. What pleasure you are going to get in any other profession? I don't think so. This is the opportunity which can be grabbed and which is given by this MBChB program. And by this program, what I'm saying and what I'm telling, that you can reach the top of the world as a global doctor, where you can do what you have thought, what you have dreamed. So I would just say that this is a program which is supposed to be for you only, and come join us, see the dignity of the profession as well as the future, where the again the beginning of life begins in a very different aspect. So I would like welcome all of you to Texila, and it will be a privilege if you all of you come and join us. It will be a fantastic journey for you as well as a very different feeling for anyone who is coming to this particular institute as well as university. Thank you.
Thank you, Dr. Amit. So, Mushingi, do you want to share something? Would you like to share something, Mushingi?
No, not really. I just would like to tell the people listening that we definitely can't wait to welcome you to Texila and guarantee that you will have an exceptional time here.
Yeah, exactly. Fine. Thank you, Dr. Amit, and thank you, Mushingi.
Thank you.
Thank you so much.
Thank you. Bye-bye.
Bye.